recognizing the need for strategies to accelerate the sharing of health research and to get it into the hands of decision makers to help put it into practice, the Patient-Centered Outcomes Research Institute commissioned the development of a Dissemination and Implementation Framework and D&I Toolkit. These documents are intended to help PCORI develop and execute strategic plans for sharing new information with key stakeholders, to facilitate putting new evidence into practice and accelerating the improvement of healthcare delivery and outcomes.
What we're finding out now is that if you don't involve stakeholders early, they don't make the best receptor sites for dissemination.
The major reason, the primary reason that we do this engagement is because we don't want our research to sit on a shelf. We believe that by engaging those end users of the research early in the formulation of the questions, in the choosing of a study design, in the conduct of research, in the interpretation of the findings, we will have partners for dissemination at the end of the line.
Today's workshop is essential to actually present the proposed framework and tools and get concrete, candid, no-holds-barred responses to it.
One of the roles that I would love to see PCORI play a little bit more actively is really finding out what are the questions that people have and making sure that the answers that we provide are really easy to understand.
The other piece is how do you take the evidence and allow different users to leverage what they have?
One of the challenges here for PCORI, and Mathematica for that matter, is that you want sort of simplicity in information. On the other hand, you've got an extraordinarily diverse group of target audiences out there. Even if you've involved them early on, you'll learn a lot from that. So this is a very big challenge.
In thinking about dissemination of comparative effectiveness research, I think a good starting point is to make sure we understand what comparative effectiveness research is. It is comparative research that compares one clinical intervention with an alternative clinical intervention. And so we're thinking about the comparison of one to the other, not necessarily whether there's one intervention that is a good thing to do or the right thing to do. It's to focus on choices that are made by patients and clinicians about choosing one intervention versus another.
In terms of what PCORI should think about in working with our group, I think a couple of things. One is the patient population. For us, that's children and families. And different patient groups, different families are going to have different needs. So in terms of understanding that. And the second is the role of clinicians. So what role can physicians play in the important dissemination and implementation work?
If anything, we've learned that dissemination and uptake of comparative effectiveness research findings does not happen on its own. And there's a growing body of research and a vibrant community of D&I researchers who are working to improve those processes so that we can take the results of CER research and more quickly get them into routine settings of care.
We're talking a lot about pushing information out. And in those kinds of activities, you engage a group of people. And it would be really fabulous if you could look at this as a two-way information highway. So at the time that you're engaging a group to push information out, why not just turn right around and get what are the needs back that then can in turn inform the research agenda for the next round of grants.
We've really identified through stakeholder feedback on the project and through our literature review of best practices in health and healthcare and dissemination implementation is that really the three primary components to effective dissemination implementation include understanding context. Understanding really one size doesn't fit all. That you have to understand the context of your audience, of the evidence, and of the settings in which evidence is going to be used or shared. The second thing we really identified is stakeholder engagement is really critical. It's key. It's central to success. And third, evaluation of the dissemination and implementation activities that you actually conduct on an ongoing basis, that's critical to success because that evaluation informs what was effective and more importantly, how and why it was effective.
As a patient, it's what matters to me that is most important to me in my health care. It's what are the outcomes that I'm trying to achieve. And so really what we're trying to figure out is what research will address those issues, and then how do you communicate that research.
There's a lot needed to improve outcomes that matter to patients. And part of what's needed is better evidence. But clearly that's just a part of what's needed. And as you all know, the existence of the evidence in and of itself doesn't mean that it will be available to patients and their clinicians at the time of treatment.
What's going to get in the way of the framework and/or the toolkit as you've heard about it thus far?
I think from the stakeholders' viewpoint, they've got to know early on that this is a lot of hard work. And it's hard work that doesn't necessarily have an end date, and that has to be discussed.
Demystifying the complexity, I think, is the biggest hurdle for PCORI. This shouldn't be viewed by the stakeholders as a rule book, but more as a resource guide, and trigger them to think, what am I not doing that maybe is best practice that I could be doing to enhance the way I do dissemination? I think the empowerment potential of all of this is enormous.
Write down 2 or 3 of the main themes we cannot fail to carry forward here.
First, thinking about the goals and the metrics to know achievement of the goals first.
Number 2, think more about sustainability early on and what that process means. And number 3, more and better engagement and specification of who does what, where, when, and why, and how that relates to different types of engagement and D&I strategies.
Clarifying who is the audience, simplifying the pathway through the materials and sometimes needing it tailored to the audience, assuring a patient-centered approach, and we snuck in a 4th one, which is web-based tools.
Sustainability, of course, patient-centered, and to uncover ROI for each action.
I think the stakeholder feedback today, as with the feedback and the input that occurred throughout the development of the process, is helping us to, and the team, to continue to refine and optimize the framework to encourage the kind of commitment and involvement in the process that we expect will be needed in the future.
Stakeholder and public input received from the December 10th workshop, as well as online, will help to inform the revision of the framework and toolkit documents and the final products that are delivered to PCORI in February.